It's interesting. We've talked to a lot of adult asthmatics, many of whom had symptoms when they were children as well. And a very, very common theme has been how much they hated gym class. They hated
Right.
the coughing and wheezing. They hated being picked last. Sometimes they just hated going outdoors. Is there any advice that you can give parents and children about feeling better about exercise?
Yeah, that's very, very common as well, what you described with our patient population. Well, I'm a kind of very, I think, as I believe that there is a very perfectionist approach here, where the vast majority of asthmatics can be controlled, and not only can they be controlled when they don't have symptoms and don't require oral steroid rescues, but they can actually exercise. And we believe that exercise is, when it's done properly and safely in a monitored setting, is almost therapeutic for asthmatics. In fact, there's some degree of exercise physiology studies that are out there in the last 5 years that are starting to look at that and see the benefit of the exercise component of asthma therapy. So for patients and children who have real difficulty with being active, the first question I always ask them is, where are you trying to be active? I'll give you a simple example. I have an 8-year-old who I've treated for a couple of years now, and he is somebody who is actually quite allergic to outdoor mold, and he came in requiring multiple oral steroid bursts. It had actually affected his height significantly, and he was growth stunted. He was also in the ER regularly. I was able to stabilize him over a year of time, and he's on a minimal amount of medication. And one of the first things I asked him to do was stop playing soccer on a standard soccer field, because soccer fields not only have grass and dust proteins, they also have a lot of outdoor mold. By doing that and asking him to change to indoor soccer, where they're playing on turf, on a mat, and he still gets to enjoy what he's doing, his lung function is maximally improved, and he's feeling really good.
That's a great story. It seems like it's such a little change, but it could make such a big difference.
Absolutely.